My name is Sarah Terrell and I am in the BSN program at Columbus State University, and I am here to present to you on a quality improvement project that I've been working on to help improve patient outcomes in the operating room at St. Francis Hospital. So we are focusing on reducing and preventing surgical site infections, and our abstract here just goes into the details of the project as a whole. And basically, surgical site infections are the second most common hospital-acquired infection and are completely preventable. Reducing and ultimately preventing surgical site infection rates improves patient outcomes, reduces patient readmission rates, and helps medical facilities maintain accreditation. And we are choosing to focus our project here on the operating room and what we can do there as registered nurses to help prevent these infections. So just to give you a little introduction to the project, the goal of this is to reduce our surgical site infection rates by about 50% is what we're aiming for in 2017. From there, we would like to ultimately completely prevent them totally. According to the CDC, surgical site infections can be defined as an infection that occurs after surgery to the site on the body where the surgery occurred, and these infections can be superficial or can involve organs and deep tissue. According to the article Prevention of Surgical Site Infection, these infections cover 16% of hospital-acquired infections, and they can increase hospital readmission rates, medical costs to the facility and the patient, and even patient deaths. At St. Francis Hospital in the year 2016, we have 43 cases of surgical site infections that were completely preventable. And while we don't know the exact cost of those at this time because those patients are still being treated for those infections, we do know that we can risk patient health as well as hospital accreditation and even nurses' jobs if we don't get those numbers down and perform better this year. Surgical site infections occur because of contamination to the surgical site. So our objectives, as I stated, would be for 2017, we want to cut our surgical site infections in half. So we would love to see 0 infection rates, but we would love for our number to drop from 43 to anywhere from 21 to 22 or less. So our rationale for doing this is that surgical site infections can lead to patients needing further medications such as antibiotics, additional surgeries, more days in the hospital, as well as illness and even death. While there are multiple causes for this issue, we believe that the root of the problem lies in the moments right before incision is made. So that's where I'm choosing to focus this project. In an article called Back to Basics, Surgical Skin Antisepsis, proper skin preparation prior to surgery is considered to be the foundation for preventing a surgical site infection. So our rationale, as you've heard me mention a couple times now, is that in preventing surgical site infections from occurring, we need to educate staff and patients, we need to observe, we need to document, and we need to train, because this will help us to decrease hospital readmission rates of patients, decrease mortality rates of patients, decrease hospital costs, and maintain hospital accreditation. So our PICO question that I'm choosing to focus in on that we want to answer by the end of this project is, how do methods such as perioperative skin preparation of the surgical patient help to reduce and ultimately eliminate surgical site infections over the course of 1 year compared to current operating procedures? I pulled several pieces of evidence as to why this change is needed and how it can be done. Mercy Health Center in Oklahoma City, Oklahoma saw a 78% decrease in surgical site infections over the course of 1 year by focusing on their management of patient care before and during surgery. They saw originally one infected patient per 50 surgical patients, and after implementing new procedures, they had 0 infections per 500 cases. What they focused in on was preoperative antibiotics, maintenance of a patient's core body temperature, and correct preparation of patient skin prior to incision. And since that skin preparation is primarily the registered nurse's job, that's what I thought was most important to focus in on for this project itself. In another article called Achieving Zero, a hospital in Athens, Georgia, they wanted to decrease their rate of surgical site infections by 40%. They focused in on new surgical dressings, new suture, and standardization of all processes, which is ultimately what we're doing with this project. And what they saw was that the cost from surgical site infections went from $250,000 annually to $40,000. Hospital days were reduced from 156 days to 24 days, and their overall surgical site infection rate was 0.7%, which is less than the national average. In another article called Trends in Surgical Site Infection and General Surgery at a Tertiary Hospital, what they saw was they had a reduction in their surgical site infection rates down to 3.63%, which is approximately 27 patients out of 8,000. And while this is above the national average of 2.62, it was a reduction for them, and what they focused on was the preoperative antibiotics, as well as complying with strict intraoperative guidelines in a method of making sure that everything was done the same way with each patient each time, that there was no variance whatsoever. So my recommendations are that we start with education. According to the article Infection Prevention in Shoulder Surgery, there have been multiple studies that show improved outcomes or a complete decrease in or lack thereof of surgical site infections when using a chlorhexidine-based scrub such as ChloraPrep versus betadine. And betadine you can use when the patient is already infected, but if they are clean, no infection, we should be using the ChloraPrep each and every time, which is what the facility I'm in currently uses, and we will continue to use. We just need to use it correctly. So we will educate our nurses on that, and we will train them and have them do a return demonstration on a dummy to show that the correct way to prep is from the surgical site outwards, and that we're going to be using hand hygiene prior to and after skin preparation. Also, we're re-educating on sterile technique. And each nurse will do that. When they pass, they're free to move on to procedures in the operating room. If they don't pass, they will repeat the procedure until they pass. From there, we will be doing demonstration in the actual operating room on live patients, and the clinical educator will observe each nurse as they perform their skin preparation and let them know if they've missed a step so that they can start over. Then we will perform tracers, and tracers will be done anonymously by other registered nurses, by the OR educator, and the nurses won't know when they're being observed. We will use this checklist that I've developed here, which literally just goes through each step that the nurse should be performing as they're prepping the patient, and the goal is to make sure that all the boxes in the left-hand column are checked, because that is the yes column. They did what they should have done. If for any reason we're checking a no, we need to pull that nurse to the side, we need to discuss it with them, and we need to make sure that we are going back to the beginning every time, always going back to the education piece. Is there something they missed? Is there something that they need to know, so that we can ensure that there's a standardization of all processes? So we will evaluate our success with this by monitoring surgical site infection rates each quarter throughout the year of 2017 and discussing these results at each staff meeting that we hold monthly. The expected outcomes will be that we have a decrease in surgical site infection rates by at least 50%, and then ultimately in moving into 2018, we would like to see 0 infection rates across the board. If for some reason we're not meeting our goals as we analyze this quarterly throughout the year, we will implement new processes. We will go back and we will look at what could we tweak, what can we work on better. But the belief is that if we focus in on this, that we will cut our surgical site infection rates in half. So in conclusion, there are multiple ways to prevent surgical site infections from occurring, but starting with one procedure and working from there will allow us to see what is working and what is not in an effort to reduce surgical site infections. These infections cost patients and hospitals a lot in terms of time, health, and money, and are completely preventable. Taking these actions will help our hospital to improve patient outcomes by decreasing patient recovery times, length of stay in the hospital, out-of-pocket costs, and increasing patient health and satisfaction.